Hi everyone, my name's Abigail. I'm a therapist, a counsellor and a psychic medium. And today I want to talk to adult parents of adults or late age teens who misuse substances or have mental health. And I want to talk about this because it's something that comes up all the time with my clients, and it's around working with other supports and therapists and how important it is for your person who is making changes in their lives. So I think I made another video and it was all about how important it is for you as the parent to not buy into any of this story that the person who's been using may have around your contribution, like your history, your family history. I mean, it's reasonable to have short conversations and apologize if there's things that you think, yeah, I could have done that differently. Or what I would say is one of the most important things is that you have your own support network, because if you look at this through a family therapy model, you actually are still holding the position of parent, and you need to do that. And people who have had adult children who've had mental health or substance misuse, they're very cagey at getting around your role and pushing your role back down here, and it becomes a dominance and a power struggle, and it makes it really tricky because the adult parent, let's call you parent, is often very concerned, worried, anxious, guilty about what's been happening for their child for years. And it's really easy with that emotional state to be manipulated or to believe that you are responsible for this situation. And it's a really common theme in families where there has been substance abuse, and I've made other videos about this. So what I'm going to say is, first and foremost, when you have an adult child who has substance misuse or mental health, get your own supports and really lean on those, because what ideally where we need you to be is strong and back in your position as parent, because adult parents have roles in their adult children's lives as well. You don't finish bringing them up at 18 and you step out. The problem is that this is a really complex adult child to parent, and to do that you need a lot of support and guidance. And like any complex situation, the stronger you can be in your sense of confidence, the better. It doesn't mean you're going to have all the answers. It doesn't mean that sometimes you might make mistakes. It doesn't mean that, you're going to change it overnight, but you're going to do better if you can have confidence in yourself and whatever you decide to put in place, that you do it really well. So I want to talk a little bit about addicts and substance users and people with mental health who will often have enormous amounts of insight into their condition, and they will tell you about their understanding of their own behavior. They'll quite likely even take responsibility for it. They will tell you how they got there. They would have read up on, narcissism and trauma and all sorts of things, and they will be diagnosing people left, right, and center. And, I want you to look at this as really positive, because my way of thinking is that every addict I've talked to doesn't want to be an addict. And what they're doing by learning about people, behavior, and themselves and gaining insight, because they recognize that they have a problem, is they're trying to understand. They're trying to work out, how did I get here? And in working out how I got here is how you work out, how do I get out of here? How do I deal with these intense, overwhelming feelings and emotions and patterns of behavior that I haven't been able to regulate besides with drugs? How do I do that? And so don't be surprised if your child has a lot of insight, or they might just be, it's your fault, it was my upbringing, and shut down. And if they're not a person of many words. But what I see, especially in females, is a lot of insight, and even males actually, a lot of depth and understanding how they got where they are. Now, the biggest thing that I think everyone needs to understand about emotion is you can recognize the emotion and you can understand it, and you can probably have a really good idea of why you're the way you are and why you react the way you do. The issue is we need to resolve the emotion. Every negative emotion, in my view, including disappointment, fear, anxiety, hatred, anger, every single one of them, even down to the small ones, is fear-based. And once you resolve that, and I can tell you this too, on the other side of every fear-based emotion is insight, love, and understanding of this world. So, and your place in it in the best way possible. So the issue is, as a family, this issue's come up. It's probably been playing out for quite a few years, and it probably needs to be dealt with. Someone, or a couple of people, maybe both parents, have to decide that this is going to change. And the person with the addiction is seen as the symptom bearer of the problem within the family, and they are the one that is the loudest voice, or the, creates the most chaos, and they're the one that's easy to look at them and go, yeah, that's where the problem lies. But it's actually not true. In some ways, yes, we're not going to let them off the hook, but let's have a look at this. So what I suppose I'm saying in a roundabout way is that as a parent of an adult child, you need to do the work for yourself. And I've done other videos on this. You need to be in charge of yourself, because this adult child is going to be very cagey. You're going to hear from them, I've no doubt, that when they commit to some type of therapy or support, like say they go to a drug and alcohol counsellor, they'll possibly come back and say to you, that person doesn't know much, they don't understand me, I don't like them, they said this, they did that. And the reason that they do that is because they're used to the addiction being in control. If we let that person in, that will challenge the addiction story, and the addiction doesn't like that. So there's this tendency to go, that person, that nurse, that doctor, that specialist, that expert, that they don't understand me, they don't get me. And you know what? They probably don't. Maybe, because this person's very vulnerable to feeling everything. But by you being stronger and having your own support system, you'll be able to see this and recognize it for what it is. It's a barrier to healing. It's a barrier to getting better. It's a barrier to wellness in the family. So you'll be able to support your person, your adult child, to work through this and keep encouraging them to go. But you're going to need these things. You're going to need to be able to see these things when they come along, instead of being blindsided by it. Because it's a tricky business. Healing's a tricky business. Here's another thing you need to think about as well, and this is another reason why you have to be strong. Oh, whoops. If you've got a young person, say they're 27, and they're getting off drugs, and they have been using substances since they were 16. You know, every other 16-year-old in the world has been having development stages. So 16, let's look at a 16-year-old boy. So 16, 17-year-old boys, oh my goodness. So they're trying to work out power in the world. They're taking risks left, right and centre because their frontal executive functioning isn't fully developed. They're all over the shop. And we do know that they grow out of that stage. They come through it, and they need a lot of boundaries, but they need boundaries to push against, to feel safe and know how far can I go. And, they'll get through it. And then, by 23, there's another stage of settling. And then by 26, we know that their frontal lobe comes online, and making better decisions is really good. If your person, your child, has been taking substances since 16, they're going to be emotionally and psychologically in many ways 16. So there's going to be some catch up to do. So don't be surprised if you're thinking they're going to come out the other end in one way and they don't. Now, the issue is there will be ways, some little ways where they are ahead and they have caught up, but you're going to need to put a lot of support around, because one of the other risks too is if they've come off their substances and they're doing really well, okay, there's something that's really important. If they go back to substance use, they're probably going to go to where they were previously, which is a higher level of their substance, and they might take too much. So that might be something that you do need to remind them of, and their medical people need to remind them of, because we need them to be thinking straight. And I think much like teenagers, their ability to hold information is sometimes limited. And even if you're annoying, it's better to be a reminder than not. And you know, teenagers have this stage of development that they go through where they believe that literally it feels like they're on a stage and everybody is looking at them, so they have to perform. And that's what it feels like being a teenager. And if your young person is still at this stage, that's primarily the focus. Like, who am I in the world? How am I presenting? What am I doing? How am I valuing my relationships or making them work around me? They haven't got a strong sense of who they are. So as the parent, it's really important to know that information as well and work with that. And look, there's a lot of support and guidance around. I'm happy to give sessions on that if anybody wants to reach out. But the next thing I'm going to say is, this young person, they really need their central nervous system to be the best it can ever be, and their sensory issues to be the best. So it's really important to support them. If this is your role and this is what you're doing, and even if it's not, I think it's really important to keep promoting this and pushing this, because they will hear your voice in their head, because they do want to get better and you're important. Regular sleep times. It's not okay to stay up all night and sleep all day. I mean, obviously, if you're on some type of medication, you're just coming off everything and all the rest of it. But generally, no, that's not how the world functions. And they need to fit in with the world. The world does not need to wrap around them any longer. They need to make some adjustments and some changes, and they need to be brave and step into life. The other thing is, you're not going to heal a central nervous system by eating junk food and high carbs and drinking sugar drinks and eating high levels of sugar. You're just not. You're going to have to look at diet, protein, which is good, fresh fruit and vegetables, and lots of water, and the minerals to hold it in your body, and good supplements. Like, it's that obviously go with your medical support and whatever medications you're on, because as I should have said at the start, I'm no doctor, but you will have a plan, and you will hopefully have someone available that you can talk to and work out what's reasonable. But you literally want their body to heal, and on a sensory level, try and keep things, you know, if they're living with you, try and keep it calm. Try and watch your voice, modulate your voice so it's calm. And you know, this is really interesting, and this is quite amazing actually. If you can talk slower, it's more likely that they will take on board what you're saying. It's just because the processing of their way in which they take in information has likely been impeded for a while, and it may have even been a problem right from the start that you didn't even know about. So that's another thing to keep in mind. So okay, let's go back and just review this. So one of the things is, if you're a parent of an adult child and you're supporting them with substance misuse or mental health, it's really, really important that you have your own supports in place, because it's not okay to constantly be giving in to whatever the mental health might be telling you is going on. Look, I can tell you, I've worked with families forever, a long time with mental health, but I also had an experience with a family member who had mental health, and what I realized is, the more I didn't buy into the delusions and the paranoia and the voices, the more I kept reality and said, no, this is actually where you are today. Ground them, bring them back. This is where you are today, and this is what's happening in the next hour. This is what's happening today. This is what's going to happen later. That voice is likely from your illness. I don't know if other medical professionals out there, if this is the way in which they work, but I know that in my experience, it worked really well to constantly just kind of bring it back to, this is the reality. You're at home, we're going to eat dinner in a while, we're going to put the TV on, we're going to, and the expectation is that you clean your room, because the whole house is, you know, we need to have a smooth flow to the household, and you're important. So that's just my experience. Okay, back to what we've talked about today. So the most important thing is that you have your own support, because you want to recognize when your adult child is sidelining you and saying to you, I can't work with that professional, I can't do this because I can't do that, because you want to be in control and know what's best and be able to be rational and reasonable and pull them back in line. And as much as you can, you know, it is an adult we're talking about, but I think the more they can trust you and lean on you and you in your confidence, the more it's going to settle for the whole family. Routines, sleep routines, expectations that they, you know, pull their weight within the household if they're living with you or in their own household, reminders, doing lists with them and here's another thing, do a list and put it up on the wall in colours, because colours, and write it big and bold, go to different parts of the brain, and it's easier to take in. Even draw a little picture next to it with a stick figure. It'll be easier to take it in, and they're more likely to follow through. Reminders on phones, calendars, all that sort of thing. Also, don't get too involved in old discussions and arguments that are circular and go nowhere. It's not worth your while at the moment, and just try and be present. Talk with slow conversation, be direct, be honest, be open. Shut down conversations that are not going to go anywhere about who's to blame for this and that. Like, yeah, okay, well, let's talk about that later, and maybe someone can support us to talk about it. Let's try and understand that later. The most important thing is to get this person back into the world in a way that is functional, that they haven't been for a long, long time, and that they're going to need ongoing support. And remember, if your person started doing this at 16, they're going to be 16 in some ways, and you're going to have to deal with that as well. So get your own counselling, get your own support, ensure they go to their appointments, let them learn how to repair relationships that they might have breakdown with their therapist or whatever, and just be committed. And, you know, relapse isn't the end of the world. We've got to be really careful around it, but I've done a video on relapse that I think is helpful. I think it's helpful. I find working with people who relapse, they're harder on themselves than what they need to be, and because this goal is so big, but it's also so achievable, but it's a family goal in so many ways. And yeah, I'll put my details below, and please reach out if you have any questions, want any support, or would like a session. I do video sessions to just be able to be present, be strong, and turn your family life around. Thank you.